So we know suicide is a very significant public concern. In fact, I would call it an epidemic at this point.
Yes.
Number 2 cause of death in adolescence, in combination with accidents, which might mean it's probably number 1 if you really
Yeah, that's
parsed
one of
it
the
out
arguments
or
that I've been with the
Right.
CCD. You know, the number one's unintentional injuries. It's a
Mm-hmm.
group. You have your drug overdoses in that. You have your car accidents in that.
Mm-hmm.
You have all kinds of things that are lumped into that one sum. Suicide is number 2. How many of your viewers are, especially people that's watching, realize if you have a son or daughter, you know, that's 12 to 18 or 10 to 18, the second most likely thing to take their life in America today is suicide. It's not to be scared. It's not to go out and tie your young person down to the bedpost. But when you're not aware, that's one of the greatest dangers, Dr. Drummond, in my opinion, the lack of, even WHO, the World Health Organization, the biggest danger is the lack of the awareness of the impact of suicide upon our communities. Not to be scared, but to be knowledgeable.
700,000 people a year die of suicide.
All right, we're losing 127 young people per week in our nation, verifiable. The number's higher than that if you could put some type of idea in there for misreported suicide. But verifiable, what other thing could be taking 127 of our kids every week and we wouldn't be up in arms about? That's how impactful it is.
Mm-hmm. And as a psychiatrist, as a clinician in my career, I've worked with, say, thousands of people that are having suicidal ideation. And I can say with 100% confidence that it's treatable, curable, and if you come out on the other side, you're going to look back and it doesn't make sense anymore.
Right.
However, when it happens, it's all-encompassing and very real. So it's very important that we work and train families, peers, teachers to recognize it, look at it, and talk about it. Because if you get your hands around it, you can actually get through this time. There's a function of time, correct treatment, therapy, social support, et cetera, that really can cure this. I mean, honestly.
Yeah, there's 2 major studies that have been done. Both came out with the same example when we're talking about young people. You know, 4 out of 5 young people will demonstrate either verbally, behaviorally, or both ways warning signs before they attempt. That means 80% of the time, if we can train people who are around that young person's life, not just really self-identification, we can train people to recognize those warning signs and then know how to appropriately respond to those. And I don't mean be a counselor yourself. None of our programs do we say when you get through training, you're a crisis counselor. You know more now to be able to identify and know how to appropriately respond. Who can I go to? Who in my community can I respond to get help? That's the key. But if we can train more people, we can stop 80% of the suicides just by what we know today.
When it's time to get help for yourself or a loved one, we have a new resource in America, 988. That's our suicide prevention hotline, and it's a way to identify resources for yourself or someone that you care about that might be struggling with suicide thoughts. If people are interested in some of the Jason Foundation materials, how can they access that, Clark?
The simplest way is to visit our website. It's jasonfoundation.com. Most all the programs that we've talked about today and even more are available there. Many of them are downloadable. There's no charge because of our affiliations with folks like HCA. All of our programs are there to be ordered or to be shared. A lot of them accessible online. Just simply go to jasonfoundation.com.